turn now to the medical headline involving Angelina Jolie, revealing the bold decision she says she made for her children nearly 2 years after undergoing a double mastectomy to reduce her chance of developing cancer. Now the 39-year-old choosing to have her ovaries, her fallopian tubes removed. But tonight, warning other women about following suit. She's urging caution. ABC's Cecilia Vega now.
One of Hollywood's most public faces tonight is sharing a very private decision. Angelina Jolie says a recent blood test detected what could be signs of early ovarian cancer, the very disease that took the life of her mother. About 20,000 American women get ovarian cancer each year. Most will die from it. And so last week, Jolie had her ovaries and fallopian tubes removed, a preventative surgery that she calls the best option. I told myself to stay calm, to be strong, and that I had no reason to think I wouldn't live to see my children grow up and to meet my grandchildren. It is a surgery that comes with severe consequences. I will not be able to have any more children, she writes, but I feel at ease with whatever will come. It's the second stunning health revelation from this leading lady. Nearly 2 years ago, Jolie underwent a preventative double mastectomy after testing positive for BRCA1. Women who carry this gene mutation have a nearly 65% risk of breast cancer and a 39% risk of ovarian cancer.
I didn't expect there to be so much support, and I was very moved by it.
The so-called Angelina effect prompting more women than ever to get genetic testing for cancer, a reaction that surprised the actress, as she told George Stephanopoulos last year.
It's connected me so much to other families, other women. It's been a really beautiful journey.
But carrying a gene mutation, Jolie says, does not mean a leap to surgery. This time, she emphasized that she and other women just like her have options. She writes, I feel feminine and grounded in the choices I am making for myself and my family. And Jolie says when you're faced with decisions like the one that she just had to make, you realize what matters in life, what is important, really. And she says she finds peace in that. She also, David, says that her children will now never have to say, my mom died of ovarian cancer. David?
Cecilia, thank you. Let's get right to ABC's Dr. Jen Ashton. And Jen, you and I were both struck by what Angelina Jolie wrote. She said this does not mean a leap to surgery for all women going through the same thing. In fact, you say that's an important point.
Absolutely. And in fact, 30% of women choose not to have the surgery, but the benefits are really clear. Studies have shown that in women with this mutation, when they have their tubes and ovaries removed, it cuts their risk of death by 70%. But what's really new here, David, is the fallopian tubes. That's where the majority of ovarian cancer is thought to originate.
But that's a stunning number, cutting the risk by 70%.
Right.
And in fact, you say you've performed this procedure many times.
Yes, and it's minimally invasive. Generally, low-risk surgery can be done in as little as 15 minutes. There are always risks, small risks due to anesthesia or bleeding, but the major impact is that it does put a woman into immediate menopause, and those symptoms can have a major impact on her quality of life.
And as you were telling us in the newsroom, it's important to lay out all the options with your doctor.
Correct. Lowering your risk could be as simple as taking a birth control pill.
All right.